Frontline workers around the country sounding the alarm about the COVID Delta variant. Nearly every state in the country except South Dakota and Wyoming is reporting an increase in new COVID cases. The average number of cases in the U.S. is up 158% in the last 4 weeks, with hospitalizations up nearly 40%. Senior national correspondent Steve Osinsami has the latest.
Healthcare workers in the nation's hospitals are concerned this morning by the new numbers of COVID cases they're seeing again, most likely caused by the Delta variant of the coronavirus. In Oklahoma, the average number of hospital admissions for COVID-19 has nearly tripled in the last month.
We're basically full now. We hadn't seen that since the height of the pandemic in January and February.
Every state but South Dakota and Wyoming is reporting a rise in new cases. Nearly 19,000 people are currently hospitalized nationwide, about 26% more this week than last week. That's still, of course, much better than the all-time high of 125,000 COVID-19 hospitalizations that the country reached in January. But authorities worry that the numbers are moving in the wrong direction. George spoke to Dr. Ashish Jha earlier this morning.
The evidence is getting more clear by the day. If you're not vaccinated, you've got a very good chance of getting the Delta variant and getting very sick.
That's right. The evidence is that this virus is going to be with us for a long time. It's going to become endemic. So everybody is either going to end up at some point getting vaccinated or they're going to end up getting infected. People really have to be very careful out there if you're unvaccinated. And the best way to protect yourself is to get the shot.
Authorities here at the CDC say that most of the outbreaks are happening in states with low vaccination rates, but they do say there is one bright spot, that in these same states where the word has gotten out about these new infections and new hospitalizations, they're seeing a slight increase in the number of people who are newly vaccinated. Diane?
All right, we'll take the bright spots where we can find them. Steve Osinsami in Atlanta, thank you. And let's bring in Stanford Health physician Dr. Alok Patel for more on this. Dr. Patel, thanks for being here. You know, for now, only kids 12 and over can get vaccinated, and many parents are hesitant to vaccinate their kids at all. So how vulnerable are kids and teens to the Delta variant?
Well, good morning, Diane. You know, teens right now are still as susceptible as they always have been throughout the pandemic. The one thing that's more concerning, as everyone knows, is that the Delta variant is way more contagious. Now, we don't necessarily know that it's more lethal per se, but if you have more children who are exposed right now, you're going to inevitably get more severe illness. And, you know, it breaks my heart when I see these intubated children in the ICU in Mississippi who are not eligible to get vaccinated, but are at risk because of the adults around them who are not getting themselves protected. And, you know, even right now in the Bay Area, I've seen and heard of stories of teens getting COVID-19 and getting symptomatic illnesses when it's totally preventable. So kids, teens, adolescents are absolutely vulnerable, not only for that severe illness, but also for long hauler symptoms in the future. We've got to keep them protected.
Now, some schools are set to bring students back as soon as this week. And now the American Academy of Pediatrics is recommending everyone wear a mask in school this fall because so many kids won't be protected. So what do you think? Is that necessary?
You know, it's really hard to kind of make national guidance about masks and have all these little stipulations about your local state and vaccination rate. But I do want people to look at the new guidance and look at it from an optimistic angle and realize the American Academy of Pediatrics and public health officials are doing everything they can in terms of this layered protection recommendation to prioritize getting kids back in-person learning. And you know what? If we don't want kids being masked, then we have to look at our own communities and say, well, what are we doing to keep them protected? And that's vaccines. And so, you know, we have a special eye on all the schools in southeastern United States who don't have high levels of vaccination. When they reopen schools, there is a huge potential for local outbreaks to happen. So I stand by all the things that we can do to keep kids protected, to ensure that they're back in classrooms where we know that's the best way for them to learn. And that's the best way to kind of get rid of the disparity in education we've seen over the past year.
The Prime Minister of Israel says data there shows the Pfizer vaccine is giving, quote, significantly less protection against infection from the Delta variant. So what does the data show at this point about the effectiveness of vaccines against the Delta variant? And what do you make of that?
You know, Diane, this one's tough because, you know, there's studies coming from all over the world now pouring about the effectiveness of the vaccine. Now, Israel has a smaller study that people are citing, showed about a 64% protection rate. But if you combine studies from all over the world, both Pfizer and Moderna are above that 80-ish, 90% effective against the Delta variant after getting the full series. Even early data shows that Johnson & Johnson here in the United States is above 60% protective. Now, yes, some people might say, oh, that's not 90%. But guess what? If we have enough people protected by getting fully vaccinated, that 60 to 70% is still pretty solid. And that's why we are seeing that 99.5% of severe illnesses right now, hospitalizations, are all in the unvaccinated, because the vaccines still absolutely work against the Delta variant.
So this 80, 90, 60% that you're talking about with Pfizer, Moderna, J&J, this is against infection at all, not just serious infection and hospitalization?
This is correct. This is against infection at all, symptomatic illness. Now, remember, the numbers are still moving around, but the question isn't necessarily if the vaccines work against the variant. The question is more about the durability and how long the protection lasts. So is there a difference between someone who was vaccinated by Moderna or Pfizer in December versus someone who may have gotten it over summer? And that's where we need to see more data. And that's where the whole debate about the booster shot is really coming into play.
Got it. Now, England is ending nearly all of its COVID restrictions today. Cases there are rising, but hospitalizations are staying low. So what does that tell you?
It's almost like what we saw here in the United States. You know, from what I've seen, there's about a 65% of people living in England are fully vaccinated. They're about to have Freedom Day, which we've had Freedom Day in sporadic times throughout this country. Some Freedom Day started way earlier this year, whereas in the Bay Area, it was in June and so forth. And what I'm worried about in England is the same thing that we see here, our local outbreaks. Like I see right now on screen, there's a packed nightclub. I'm worried that the people there who are unvaccinated in England are still going to be susceptible to the Delta variant. And we may see these pockets of outbreaks all throughout the country. And then what's worrisome is those people can inevitably get on planes and you could start to see more of these outbreaks. But same rule as always, those who are vaccinated are going to be protected. So we're likely going to avoid those massive national surges.
And at least 3 people staying in the Olympic Village have now tested positive for COVID. How concerned are you that the Olympics could lead to a surge in cases?
The Olympics are going to be a very interesting litmus test for our level of protection. But I mean, you have 70,000 people coming from around the world. Those are athletes, trainers, people associated with the Olympics. And so, it is concerning that athletes or anyone who are unvaccinated are going to get sick. And it would be devastating to see someone train all this time and not be able to go and compete. But at the same time, Japan does not have a very high vaccination rate. There seems to be a divide in Japan, a huge divide about who wants the games versus who is not. So I think some of the cultural significance are going to be missing from this Olympics. I'm hoping that they're doing everything, not just promoting vaccinations, but also promoting all the other mitigation strategies to keep the athletes safe.
All right, Dr. Alok Patel, always great to have you. Thank you.
Thank you, Diane.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.